A video of a 23-year-old young woman dropping dead, face down, while dancing has surfaced once again in India, raising questions and shocking the country, given that many of these videos, similar videos, have been surfacing in the last few months or so. Questions are being raised on what exactly is going on, just why so many young people are dying in this fashion. We'll tell you more in this report. This video surfaced a few days ago and has gone viral. 23-year-old Parinita Jain collapses and dies at her cousin's wedding. The shocking video putting the spotlight again on why just so many people are dying of heart attacks. A similar case where a 16-year-old girl in Telangana's Mahbubnagar district collapsed and died while performing at a school farewell function. And there have been just so many more instances. So there are two things that are being now seen. One, which is an increase in heart attacks in the younger population, and also increase in the number of women suffering from heart disease.
In the last 10 years, there has been a 2% increase per year in number of attacks in young individuals. So pre-COVID also there was an increase in younger individuals being affected by heart diseases. Post-COVID, we don't have exact data, but the surge appears to be higher. Because of the virus per se, inflammation, it can cause your blood to get clot in the arteries or in the veins, leading to cardiac issues. Other than this thing, because a lot of people, they lost their jobs during this era, so the depression crept.
Major risk factors for heart attacks are diabetes, hypertension, high cholesterol, smoking, and family history of heart diseases. Increasing stress, lack of exercise, poor eating habits, and inadequate sleep are making even young adults and women vulnerable to heart attacks. These should be the big red flags.
Diabetes, sugar, hypertension, increased blood pressure, obesity. Then comes dyslipidemia or abnormal cholesterol levels, tobacco and in any form smoking or chewable tobacco. They can both lead to cardiac diseases early than it was supposed to happen. Lack of exercise or sedentary lifestyle. Recently, we have also seen the patients who are mentally disturbed or depressed can also develop heart diseases at a very early age. There can be genetic predisposition to heart diseases.
The timing of surge in heart attacks is suspected to be directly related to the COVID pandemic. The COVID virus, once inside the body, can cause the heart to be inflamed. This condition is known as myocarditis. This further makes it hard for the heart to pump blood throughout the body. It's not the vaccines. The Indian Council of Medical Research has said it. But COVID linked to heart attacks and heart ailments has been established. So how does one prevent a heart attack?
By doing regular checkups, by keeping your BP and sugar under control. If you are obese, try to lose weight by proper measures. Get an active life. Do at least 30 minutes of moderate intensity exercise. We take a lot of saturated fats, ghee, cheese, butter. We take a lot of sugars. So these things should be avoided. Processed food is a definite sure shot no.
First is check yourself for risk factors and already existing heart conditions if you have any. Then comes care. How do you care for your heart? You must make sure that you eat healthy diet, which is low in fat, low in carbohydrate. You must make sure that you achieve and maintain an ideal body weight. The third C is consult. Once you have checked for risk factors, you know what to care about, but you must consult a doctor. Last C is cure. If you have high blood pressure, high cholesterol, diabetes, you must take medicines.
When it comes to preventive health checkups, when should you do one and how frequently should you do it?
Earlier there was a concept that we had a cut-off ages based on the guidelines, and the cut-off age was 35 years, and that is the time when we start checking once. But nowadays, we have a couple of patients who were as young as 7 to 8 years in the last month, for which we had to do an angioplasty. So, but this patient had a very strong family history. So, in an average, we don't recommend such young kids to undergo checkups, but a person at the age of 18 years, I feel, is the best time to start checking oneself.
Are cardiac ailments more common in men than women? Or are women also becoming vulnerable?
Usually it was thought that the young women, especially those before the menopause, had a lot of protective effect because of estrogens, and which it is. But once the menopause is gone, then the beneficial effects of estrogen are no longer there, and many of these ladies have more risk of getting heart attacks, so much so that it almost equals or maybe even more than that of men by the age of 70 or late 60s. We must get our cholesterol checked at least once, and if the bad cholesterol, which is the LDL, it is high, or if the lipoprotein small a is high, it means that the risk of getting heart attack is more.